Hi, everybody, and welcome to the GetHealthy.store brand and product feature webinar. And with me today is Dr. Chris Meletis. He is the independent clinical educator for True Niagen. This is an incredible product, an incredible brand, so many things to offer. Dr. Meletis, thank you so much for being here.
Well, thank you, Dr. Stroud. It's a delight. Get Healthy is a place I like to go with my patients, and you offer such a great service and now this educational venue as well. So thank you.
Absolutely. Thank you for being here. So I just wanted to get a little bit of an understanding of what is True Niagen, the brand, and what products do you offer here for our clinicians on the Get Healthy store?
Great question. So True Niagen is a product that is nicotinamide riboside, or also known as Niagen. And Niagen is a precursor molecule for NAD. Lots of clinical trials, some over a dozen human clinical trials, 200 published studies as well on nicotinamide riboside. And the reality is that nicotinamide riboside, as we learned all back in the day of biochemistry, is necessary for 500 different enzymatic processes in the body. So we know, like magnesium, we say about 300 different processes, B6, maybe 60 different processes. Nicotinamide riboside precursor for NAD, 500 different enzymatic processes. So as we get older, our NAD levels drop. In fact, they did a skin study in 2012 showing that human skin cells have 50% of the NAD that a younger person would have. And so the same thing happens at our mitochondrial level. So the NR, for me personally, I take it. My wife takes it of 31 years. She's put up with me for 34 years, but 31 years official. And we just take it as part of our routine. And I use it a lot with my patients as well.
Awesome. Well, I've used a lot of NAD products in my clinical practice. I just was introduced to True Niagen, so I was really excited about it. What sets yours apart? What is the differentiator?
It's the clinical research. Without a question, if you go to PubMed, you type in Niagen or nicotinamide riboside, it is actually what is being studied pervasively. And the other products out there that are proposing increasing NAD levels just haven't spent the time, the energy, or the resources to actually get the patents, to get the studies, to get the FDA clearing. And so, interesting, I'll share an example. A 2019 study showed that 300 milligrams, and this was with 140, and you and I will enjoy this qualifier, 140 healthy overweight people, whatever that means. So 140 healthy overweight people, double-blind, placebo-controlled, parallel arm, and they gave them either 100 milligrams, 300 milligrams, or 1,000 milligrams of Niagen, the nicotinamide riboside from True Niagen. And the 100 milligrams, the 300 milligrams, within 2 weeks, there was a 51% increase, and it remained that way for the entirety of 8 weeks. And 1,000 milligrams increased over 140% within 2 weeks. It's sustained over that 8-week trial. And so once again, double-blind, placebo-controlled, parallel armed. And that kind of research lets you and I as clinicians know with confidence, if we're trying to support the Krebs cycle, the citric acid cycle, all those lovely little, I eat my carbs, I eat my proteins, I eat my fats, but we all need NAD to get down to that next step, or as I tell my patients, pass, go and collect $200. So we get stuck biochemically, and being an organelle, you say the word beaver damming, biologically having it get stuck at, let's say, alpha ketoglutarate. Well, you need NAD, lipoic acid. So this just greases the skids to allow the diet to work better, to allow the biochemical pathways to work better, and not have the, as you and I as naturopathic docs would say, total cost them, address the cause. So this is definitely removing a very clear biochemical cause for a lot of problems.
It's fascinating. And you said a lot of good terms there, things like ATP, mitochondrial, methylation. Can you just give us a high-level synopsis of how NAD impacts all of those pathways?
Oh, in short, let's see here. Yes, I could do it. The gauntlet is thrown down. The challenge is here. So, well, every cell in our human body needs to have sufficient ATP. Of course, we know, I actually make the comparison for my patients. ATP is like the Energizer Bunny battery. Interesting factoid, when we were 30, and you might still be 30, I'm not. And so when we were 30, we made about 60 kilograms of ATP per day. For every decade from the age of 30 onwards, all things being equal, we make 10% less. So I'm 56. So if we just did the math, I'm 26% less efficient in making my ATP. I'm not making that same 60 kilograms per day. And without ATP, which NAD is critical for the production of, my skin's not going to heal. My eyes aren't going to heal. My organs aren't going to do as well as they're going to do because it's a critical nutrient, like so many nutrients in our body. So we have all our vitamins and other nutrients. But if you think about NR, nicotinamide riboside, you can say, well, why don't I just do niacin? Why don't I just do niacinamide? Well, the reality is the de novo pathway is very inefficient, whereas the NR pathway, you go through an enzyme pathway called NRK1 and 2. So when we're stressed physiologically or psychologically, we produce more NAD to fuel the mitochondria to actually allow things to work.
Well, that is fascinating. When you're talking about the NRK1 and NRK2 pathways, I always tell people, when you're in stress, you need more, and you have to know what to support your body with. There's a lot of NAD products out there, and True Niagen, I love that there's clinical studies behind it, because that's what people always ask is like, is this an effective product? And I have used this for a couple of people, not personally, but I am now going to add it based on your recommendation, because I think this is something, just knowing that our ATP production decreases by that much year after year, and me being 29 again,
Yes.
I may need some True Niagen. So what is your recommended dosage for, just clinical practice? How do you like to administer this to your patients?
Well, certainly. So I'm finishing my 29th, going on 30th year of clinical practice. I graduated in 1992. And my approach is proactive medicine versus reactive medicine. So, or as you and I would say as naturopathic docs, vis mitigatrix naturae. We're trying to help the innate wisdom of the body. So we go outside, we make vitamin D. The reality is our ability to make the NADs just diminish over the course of time. So I like 500 milligrams, the professional dose, 1 pill a day. However, if my patient has a surgical procedure, post-surgical healing, they're going in to get scoped with a colonoscopy or whatnot, a laparoscopic exam or a full surgery, I'm going to actually bump up for the 7 to 14 days beforehand, because of course you're supposed to stop all herbs and supplements per the surgeon. But then I will actually, for 3 to 4 months afterwards, have them do 1,000 milligrams. So I'll do 1,000 milligrams beforehand to really load up their innate ability of ATP and the citric acid cycle and the foods, the carbs, the proteins, the fats for working in their body. And then I'm going to give a lot of support, because the drugs like propofol, the Twilight drug that was in Michael Jackson and Joan Rivers when they passed, actually has been shown to actually cause mitochondrial dysfunction. And 300 different conditions, a lot of them that you and I see in our clinical practice, are actually related to mitochondrial dysfunction and an insufficient, inadequate mitochondrial performance.
Wow. So last question, because people always want to know, what is the protocol? What are the best complementary nutrients to help boost NAD's efficacy in the body?
Perfect. Well, a book I wrote called Mitolongevity. We need to take lots of antioxidants. So eat our fruits and veggies, of course, organic, avoid the dirty dozen foods, eat off the 15 clean. But in addition to eating our antioxidants, we need to consider what else is necessary for a really healthy, robust mitochondrial function. So I do NR, so the nicotinamide riboside, True Niagen. I do CoQ10, of course, and I love PQQ, pyroquinone quinone. And pyroquinone quinone has been shown to increase the mitogenesis, and so increase our mitochondrial density. So those are the big ones. If I was be a keto person, or I had a patient on a keto diet, I'd also support beta oxidation with some L-carnitine as well, and maybe some ribose. But the big ones in our cornerstone, CoQ10 and PQQ.
Awesome. What about kids and athletes and performance? Where do you start? Would you put a child on NAD supplementation? When would that occur? And what would you do by dosage?
So for children, they usually make a robust amount of NAD. Of course, there's biochemical needs. So I'm a big proponent of test, don't guess. I'm sure you are in your clinical practice too. So I'll do an organic acid profile test to see how that citric acid cycle is being fueled and where there's proverbial weaknesses unto their unique biochemistry. Now, for my older individuals, I'll share 2 little stories. I had a gentleman come in about a decade ago. He was 50 years old. He's a few years older than I am now. And he said, I'm going to run a a marathon for my 50th birthday. He's going to just, devour our life. I said, that's great. So where are you doing that? Because in Portland, Oregon, there was no marathons coming up that I knew about. And he said, oh, no, I'm going to Colorado. I said, okay, you're going to Colorado. So you must be training around Mount Hood, because that's, of course, where we have our altitude here in Oregon, or at least like Bend, Oregon, 4,000 feet or above. He says, no, I just been running around this area, sea level, right, where we live. I said, so what race are you doing in Colorado? Well, I'm doing an ultra marathon. I said, so you've done marathons before? Oh, no. So he decided to go all in and do an ultra marathon, like, oh my gosh. And I said, so you want to see 51, right? And so we did an organic acid profile. We supported his mitochondria. We did all the wonderful things in the CoQ10. And I can't say that's why he's alive, because a wolf chased him and an eagle nosedived him while he was on the trail up in Colorado. So I think that Murphy was not following him in Murphy's Law. But I had another wife of a chiropractor, and she qualified for 2 of the national marathons, but she had not qualified for the Boston Marathon. And she felt, okay, I'm maxed out. I don't have the PR, the personal record to get there. So we added the nicotinamide riboside, added some CoQ10, did an organic acid profile test, and she qualified. And she was exuberant. She's all in whatever she's doing. And so I see this in clinical practice, where when we support the body, once again, vis medicatrix naturae, the healing power of nature, the body knows what to do. We just need to move out of the way. And I will say the other big one, which we often forget, vitamin D is critical for mitochondrial function. And so many of us are indoor dwellers, that we don't go outside, or we're afraid of the sun and we put our sunscreen or zinc oxide on, that you and I might do. And it's like, no, you need that vitamin D, because as you and I both know, it's not just a vitamin, it's a hormone. It's like, oh my gosh. So I'd probably say, okay, so the NR, the CoQ10, PQQ, and vitamin D, I added one.
Awesome. Well, I mean, for, the best results, we want the complete protocol, and especially from an expert such as yourself, you're just a complete joy, but you're such a wealth of knowledge, and I really appreciate you sharing all of this with us. Is there any one particular, what would I say, genetic issue or condition that you would feel would be most beneficial for, clinicians in practice working with all of these autoimmune that we're seeing? We're seeing just so many big, bad things coming along. And I know that we cannot cure, treat, or diagnose, but we can absolutely support the body through biological processes. Is there any particular condition or issue that you have seen in your practice that has really benefit from, increasing NAD levels in the body?
I would say heart and immune.
Mm.
Clearly, the last couple of years, you and I have been very made aware as providers about immune. And now our patients are even more educated. If Google wasn't good enough before, I tell my patients, oh, do you have Googleitis? Is that what's bringing you in here today? That's, of course, a joke. But when you do all that research, like, I think I have this rare disease from this mosquito that's nearly extinct. I'm pretty sure that mosquito bit me. I'm like, oh my gosh. And so, but the reality is we know about cytokines. Now the general public says, I think I might be having a cytokine storm. I says, that's a lofty thing. You're probably correct. I mean, and we know aging is such a huge issue. It accelerates the aging process. And so right now we know cardiovascular disease and cancer are neck and neck for causing problems in America and around the westernized world particularly. And so I think taking care of the heart, taking care of the immune system, I'm not making any claims towards that, but once again, our mitochondria have a little system or a little membrane called MAVS. And it's actually a virus comes to our nuclear cell, and the MAVs actually responds to determining how to rally the immune system and how to control some of the cytokines. So back to that mitochondria. So if we can support the energy pathway of our body, we're going to support detoxification. And I just gave a lecture this last weekend at the National University of Natural Medicine here in Portland, Oregon, on autoimmunity, strangely enough, and the mitochondria. And so if people would like to have that presentation, I'll be more than glad to send it to them as well. So you can maybe put my email down there. But the reality is, think of this last parting thought. I think we're all a little stressed. You're mom, I'm a dad. We have their worries, our worries. We have the world's worries. We have our patients' worries. And that's the beautiful thing about what you and I do. Patients come and share their worries and drop them at our feet. And we take on their worries and help them as well. But the reality is, think of your adrenal glands. We might like ashwagandha, rhodiola, schizandra. You might name the adaptogenic herb. But if I was to personify an adrenal gland, so here personify normal American adrenal gland. I'm tired. I don't know what to do. Well, then here's some ashwagandha, here's some rhodiola, here's some maca, but I'm already tired at a cellular level. So I want to support the mitochondria of the thyroid gland, of the adrenal gland, so that when given the adaptogenic herb, it actually is taken up and utilized at a full level, opposed to tired, horse off to the glue factory kind of example. So we want to support the mitochondria and the mitochondrial cells at the adrenal level, the thyroid level. So by taking care of the mitochondria, we're taking care of virtually the potential genetic capacity. And parting thought is our cell phones. If I click on it, there'll be an app, and those apps are like our DNA. Now, how good is my cell phone if I don't have a charge? You would say, Dr. Stroud would say, I don't know, paperweight? Exactly. So our cells with that genetic potential is like our cell phone with an app. That app is not of any worth at all if we don't have a charge. So let's charge our body. That's why I wrote the book called Mitolongevity. I coined the term mitotricity. It's electricity or the mitochondrial energy of our body.
Oh, I love that, mitotricity. I love it. So it kind of sounds to me, my own personal opinion, that NAD is kind of like the backbone to success with a lot of protocols, that our body needs ample NAD to be able to do all these other biological processes.
I would say that if I knew now what I know about NR, nicotinamide riboside, and the true Niagen, 29 years ago, I think how many other patients I could have helped allow their protocol to be just that much more successful and get them over the hump. And that's what the beauty of all the science is that we look back and we're like, darn, if I only knew that for patients so-and-so. So I think NR is an important part of the tools, along with all the other things, diet and lifestyle. So no medical claims, no diagnosis, no treatment, no cure. But as an independent educator, I'll say, I'm excited. And I will tell you, if I get a sniffle, I get a cold, I'm taking my 1,000 milligrams. On a regular mellow day, 500 is okay. And so that's just kind of how I work my program, because I want to be healthy and happy for my mitochondria. And yeah, it's just kind of what we're doing is we got to take care of ourselves at least as good as we take care of our vehicles.
Oh, absolutely. And the thing that I didn't hear about during all of the last 2.5 years, I heard about D, I heard about C, I heard about all those protocols. You didn't hear about NAD.
Yep.
So I'm glad it's finally getting out there that this, particular pathway needs supported as well. And, science applies to all sides of, allopathic and natural. That's what it's there for. So thank you so much for your experience, your knowledge. I truly appreciate your wisdom in the application. And, thanks to True Niagen for putting out such a great product. We're so excited to have it on the Get Healthy store.
Well, it's an honor to be here. And thanks for everything you do, Doc. We appreciate you. And thank you for your time, and keep on being you. We appreciate it.
Same. Well, guys, if you want to curate the product, the True Niagen product, it is at the professional level, the 500 milligrams. We do have it available on your product curation tab in the back admin section of your office. Don't forget to onboard it today. You will not be sorry. It will be a game changer for your clients and patients.